I'm suggesting usually to integrate some of the herbs. And it's generally quite safe and can really improve the outcomes of IVF cycles. But doctors tend to be very hesitant about us using these herbs with our patients because they're worried about drug-herb interactions, which is understandable.
Hello, everyone. Welcome to Fertility Talks. And today we are going to talk about all things Chinese medicine. And we are super, super awesomely excited because we have Dr. Christina Burns from New York City with us in the house. Thank you so much for showing up and being here with us, with Dr. Tanya Wild and myself, Mary Wong. And you are the founder of Naturna Institute in New York City, and you specialize in the treatment of hormonal and reproductive health. And you have a big shtick on herbal medicine. So that's why this will be the best interview to have you speak to this important conversation, because a lot of people are like, Chinese medicine, do I really want to try it? Is it like, what the heck is it? When do I do it? So let's take a deep dive into that, shall we?
Yeah, love to.
I guess the very first question is, what the heck is Chinese medicine?
Well, Chinese medicine is really kind of an umbrella term for things like acupuncture, cupping, moxibustion, Chinese herbs. And so, we could say that any of these things are Chinese medicine, even dietary therapy, Eastern dietetics. So it's kind of like an umbrella term where we have all of these modalities under it that we can help to treat certain syndromes. And I love Chinese medicine because we have all these different things in our arsenal to be able to approach issues.
100%. And, if you go back to a couple of episodes, we actually talked more about Chinese medicine, but today we want to specifically go into actual physical herbal medicine. Right. So let's go into that. And Tanya, did you want to add to this?
Also, just distinguishing when to use or if we can use herbs without acupuncture alone, herbal medicine alone, because a lot of patients ask me that.
It's a great question. I think you can use it in any and all cases. I have patients that I see internationally or say on the West Coast that I just prescribe herbs to, and they're not doing acupuncture with me, and I get great results with that. And I have some people that just aren't interested in acupuncture. And so, we do the herbs and there's a long legacy and tradition of Chinese herbal medicine in China and other countries like India, Korea, Japan. And it's incredibly powerful. I actually default to using herbs in my very tough cases of treating infertility where it's not really responding to acupuncture or dietary stuff or IVF or what have you. And then I know that the herbs have to be part of the equation. So I go to it in my difficult cases, and I go to it very often, and you can use it in combination with acupuncture, which is a great combination, or just on its own.
Yeah. And I love that you speak to this because, of course, in China, this is what they do, right? Like where you'll have a whole, like in a hospital, for example, you'll have a whole wing with regards to, dealing with Chinese herbal medicine. And it can be fully integrated into Western medicine as well. But maybe you could speak to this. When a person is doing, let's say IVF treatment or IUI or basically taking Western hormonal drugs, what do you say about, can you do Chinese herbs along with it?
So I use Chinese herbs a lot between cycles for sure to try to, enhance the function of the ovaries and the reproductive system, really get a lot of circulation and nourishment there. But I do use it in cycles also. I find it very effective in IUI cycles when we're using Clomid, for example. Clomid tends to thin the lining and doesn't work as well for a lot of people. And I find that when I combine certain Chinese herbal formulas with the Clomid, they get better results. Similarly for cycles with letrozole. In terms of IVF, I do use it in IVF cycles. I generally use it in IVF cycles when there have been failures before. So if, it's their first IVF cycle and I don't find that they're really in not so good of health, and if I've been using acupuncture or herbal medicine or both leading up to their cycle, I'm like, okay, let's just let's just let your body deal with the Western medications and let's see how you do, kind of thing. Now, if they've had several cycles where the Western herbal medicine hasn't gone that well, the Western medicine hasn't gone that well, then I'm suggesting usually to integrate some of the herbs. And it's generally quite safe and can really improve the outcomes of IVF cycles. But doctors tend to be very hesitant about us using these herbs with our patients because they're worried about drug-herb interactions, which is understandable. They don't have any knowledge of what we do. And so, not the trust isn't always there. So to keep things sort of harmonious in the relationship with the patient's doctor, and to not have the patient be stressed by hearing differing opinions. Sometimes I will just keep it very simple and not do herbs during an IVF cycle, but it can be helpful when the cycles aren't going very well.
I love that you address this because this is so pertinent and this is exactly what happens. And patients will ask, should I be doing it during my IVF? But my doctor doesn't want me to. So it's like, well, you need to actually have this conversation. And I do subscribe to the fact that there should be good communication between Eastern and Western medicine versus hiding out, because then the doctors don't actually know what's working, what's not working. If they're adding Chinese medicine and they're doing it behind their backs, well, maybe we're helping them, but the doctors don't even know this, right? Okay. So, certainly that also, as you said, keeping that relationship strong with the fertility doctor, we also need to be respectful, because if they're saying hands down, no herbs, then I'm going to totally say, all right, let's just do it that way. And then there are some doctors who will say, do whatever the heck Mary wants. I'm like, okay.
You're like, that's great. Thank you so much. Yeah. Usually those are the ones that have seen the improvement in outcomes, right? And so they've like grown to trust over time as you've seen their patients and they've seen things go well. But then there are some doctors that I deal with, they just don't believe in any of this stuff. They don't want anything to do with it, and they're not even respectful, kind of thing. So I am like here in New York, I have all sorts of discussions. Some I get great referrals from doctors. We have great collaborating relationships, and other ones are just like, no, I don't want my patients touching any of this. And so it's up to the patient, but a lot of the time it's very stressful on the patient to have their doctor have one opinion and have me have another opinion. So I look for harmony and results. Yeah. Yes.
And what did you say? The doctors don't believe. Well, the truth is it doesn't actually work on belief. It's really, it can work. And I love how you address that, with Clomid or letrozole, it can work synergistically, because as we know with Clomid, it can thin the lining, as you had mentioned, it can decrease cervical mucus. So we're working not around, it's like, let's support the body as you're going through this. It's not like we're going to do the same thing, but using herbs, right?
Well, there's evidence to support it. That's the thing. We need more, according to the Western profession, we need more like double-blind placebo-controlled trials to, prove the efficacy of what we do. But there are tons of studies and tons of smaller studies to support the use of certain herbal formulas in conjunction with these cycles that have proved to be very effective. And there was actually a large study showing that Chinese herbal medicine was actually more effective than Western interventions such as IVF over a 6-month period for a big group of women. So it's got some data, but I think most doctors aren't looking at it, and I don't think the patients are either. We carry an inventory of research studies at the clinic to be able to pass those on to say, here's what we're basing some of these recommendations on, because we know that evidence helps in our Western framework of thinking.
I love that. And, the truth is, this system of medicine has been around for thousands of years, preceding Western medicine. Yes. And it's not just haphazard. It's been written and documented for thousands of years, passed on traditionally. So there's a huge breadth of what I call the longest ongoing experiential medicine.
That's a great way of putting it. And it's funny because I get asked, like, how does it work? And my answer always starts with, now, this is difficult for me to explain from a Western paradigm, or a scientific paradigm, because it predates science. So I'm like, I can draw parallels between, it affecting the nervous system or physiology and the different organ systems, and try to put that into a Western frame of thinking, but it's tricky because it's so old. It's so old, and it predates science and the way that we've mapped out the body in Western medicine.
Yeah, I love that. So thank you for addressing that. So then you mentioned safety. So can you go into a deep dive with regards to that, like safety of herbs as you're trying to conceive during pregnancy? Because people are going to be a little hesitant about putting anything in their bodies, right?
Which is totally understandable. And I think that people, should be discerning about the things that they put in their body. So, one of the major things that comes up about Chinese herbs is are they toxic to the liver? Because some doctors will be like, oh, there's some research to show that they were toxic to the liver. So Scutellaria Huangqin was one that came up as having caused liver toxicity in maybe 1 or 2 people. Very, very uncommon for the amount of people that have taken it, which is probably millions at this point, right?
Yes.
And there's no understanding of exactly what dose. There are herbs that have some toxicities. In terms of treatment of fertility issues, the herbs with toxicities are very sparingly used, if at all. In some cases, in autoimmune disorders, for example, they're used, but generally the ones with known toxicities aren't used. Now, there are herbs that have blood thinning effects. So if somebody's already on a blood thinner like Lovenox, for example, then maybe some of these ones with more blood thinning effect aren't a good idea to pair together. But we know that as practitioners in this field and specialized here, we know which ones to combine, and we know what's going on with their Western medicine protocol and what those drugs do.
Right. So then let's just jump in and say we, as in those practitioners that are well versed in Western drugs, right? Yeah. Because there are people that may be practicing and they may not really know what the Western pharmaceutical drugs are doing. So you don't want any, double interaction. And that's the Lovenox is a great example because it is causing blood thinning effects, and you just don't want to overdo it. But and you know what? Maybe Tanya can address this too, because in terms of supplementation, there's certain supplements that may do the same. So you're going to be careful with that as well, right?
Yeah, 100% omega-3s, and not just Lovenox, but a baby aspirin. You have to be careful, whatever, even steroids, you have to tons of interactions that you have to be cautious of. And I think a big question I would love to hear your answer is when to stop herbs, because a lot of patients want to know, when do I stop using them? Am I going to harm my embryo or my baby? Yeah. So I often say, around 8 weeks, you can take up to 8 weeks when the placenta is fully mature. It's probably not a good idea to go beyond that, but it's probably recommended around 4 weeks to discontinue them once you get the positive pregnancy test. But you might have a different answer for that.
It's really case specific. And, the magic of Chinese herbs is in how customized it is, right? Like we could change the herbal formula every 2-3 days. Normally I'm looking at the herbal formulas about after a week or so. But we can change them according to the phases of the cycle. Like it'll be a different formula, possibly in the follicular phase when, we're doing stems or growing eggs, and it would be in the implantation phase, the luteal phase, after a transfer or after, trying to conceive naturally. It'll also be a different formula in early stage of pregnancy. I often am not prescribing herbs in early stage of pregnancy, but there are some cases with my patients who have had recurrent pregnancy loss, or a bunch of chemical pregnancies that I am prescribing pregnancy safe, pregnancy focused formulas to maintain the pregnancy, to help save the pregnancy. And I do see a lot of complicated cases, and sometimes this is very applicable and very, very effective. So it actually isn't unsafe to take herbs during pregnancy as long as they're prescribed correctly, but you don't just take any old herbal formula that you were taking to get pregnant and then suddenly continue it on into pregnancy. Like there has to be that thoughtfulness about what are you taking and is it catered to where you are? I don't know, I have patients that will try to sort of reorder things like supplements or herbs or things. And I'm like, no, we have to discuss the herbal sort of strategy depending on where you are. And pregnancy, once they fall pregnant, is obviously a very important time to really reassess whether they need the herbs and what exact herbs they're taking. And one thing I didn't mention about safety is contamination. So you really have to make sure that the herbs that you're taking are not contaminated with pesticides or, other toxins. And so, the herbs that I'm sure all of us are dealing with are ones that are clean.
Yeah, heavy metals even.
Exactly.
Yes.
Exactly.
So then this is just talk shop for a second. Are you using raw roots of herbs as you dispense, or what form are you using?
Well, so I'm using a lot of raw, and the pharmacies that I use 2 pharmacies in the US who cook the herbs for the patient and then vacuum seal them into packets like this.
Right. So those that are actually listening to the podcast, you can't see what she just did, but she's holding up. We'll post your website, and you have a fabulous line of herbs, and it's called what is it? Junk juice. Excuse me. I love the name so much, but I forgot the name. Junk juice. And I love it because, it's like juice, but not really, because it doesn't necessarily taste like your orange juice or apple juice, just saying, because it's medicinal. So we don't expect it to taste like really lovely. Some people like the earthy taste, but most are like, ew, it's like medicine. Well, it is. So that's the whole point. But I'll let you speak more to this, Christina.
Yeah, no, it's I prescribe herbs in the form I tell my patients I prescribe them in the form that they're going to take them. So if the taste of the junk juice version is just not appealing, like they can't choke it down, this earthy tasting beverage, then I prescribe in capsules. And that's fine. Now, the strongest form of Chinese herbal medicine is in the cooked tea form. Either you cook it at home or you have the pharmacy do it for you, like I have done for a lot of my patients, so they don't stink up their kitchen. But any of the formats work: the capsules, the granules, the cooked tea, and they're great. They have to be taken daily. They have to be taken regularly. Otherwise, you're just not going to get the effect out of it.
And why?
So it's a cumulative effect, and we have to change the physiology, and we're supplying like different components to the bloodstream to get the desired effect. And if the dose is too low, like if I prescribe 3 pills twice a day and somebody takes 1 pill a day, there's going to be no effect.
No, it's kind of like working out, right? Like you do 1 rep for like a bicep curl, exactly. You're not going to get much results.
Yeah, great analogy. So you have to give it a chance and really take it properly. And this would go for supplements and for acupuncture too. Like take the required dosage or the recommended dosage to see how this works for you. And then we reassess after a certain amount of time.
Love it. And I thank you for your time. And I know you need to run away and do other things. So Tanya and I can just follow up with this conversation as you go off and do your thing. And we love to speak to you again. Thanks, Dr. Christina.
Yeah, I would love to have you on my podcast too. It was so nice chatting.
Oh, yes. And it's called Fertility
in Focus.
In Focus. Yes.
Fertility
okay.
in Focus.
Let's be practical, because sometimes, who wants to cook herbs? So she mentioned that there are outfitters that actually will cook and then vacuum seal and send it to people. But I find that can be potentially difficult as well. So from our clinic, I find that the easiest is when they take the raw roots, they cook it up, and then they put it into formulation, and then you reconstitute it at home by just adding hot water. Like to me, that is the easiest. And even then, some people.
Rather than putting it in those bags, rather than vacuum sealing it?
Yeah, that's what we do, because then you actually get more out of it and it'll last a little longer. And I find in terms of a consistency and being able to take the appropriate dosing, like I've been doing this for 29 years, right? So I just find that the powders are, and then maybe some tablets or capsules, that people are just going to adhere to it much more and be compliant, right? Which then
compliance matters
helps.
Most.
Yes.
You can just look at it and hope it works, but no, you got to take it.
Yeah. So that's about it.
Huge, for sure. And then what kind of changes are you looking for? What kind of changes are you looking for in, obviously if the outcome, the goal is pregnancy, along the way to getting pregnant, what are the kind of changes that you're seeing with patients?
That's a really beautiful question, because of course, when people come for fertility, it's like, I want baby. So it's like, Well, obviously you're not going to have that baby like every minute. any minute.
No.
So it's like, what signs can you look for shifts and changes? And one of the biggest things is, let's look at your menstrual cycle. And we did that talk about the menstrual cycle. So you need to go back to our episodes because we did deep dives around, getting to know your menstrual cycle. And so looking at any kinds of symptoms, whether it is, spotting between cycles, before and after your cycle, or even the color of the blood, the menstrual pain or PMS pain or PMS signs.
Regularity.
Regularity, blood clotting, and just even how you feel. So energetically, people can feel more calm and relaxed, less moody, less acne, less bloating. There's so many different things. And I'm not going to subscribe to like, you need to feel all of them all at once for everyone. And it may be variable for each individual.
And it may be very subtle as well. But I always find it the most exciting when I hear from patients that their pain has gone, or that their shortened cycles have now become regular, or delayed ovulation is now on time. And then you have more of an opportunity to get pregnant, because if you're not getting a cycle, and all of a sudden you're ovulating more regularly, that's exciting, right? You have more opportunities.
Yes. And how I had always put it, and I might have said this in another episode, but it's like, we don't live in isolation. So typically when people are taking herbs, they're also doing other things.
Yes.
And that's great, right? Because, you're eating right, you're exercising, moving right, you're taking Chinese herbs, you're taking supplements that you offer, and like all those lifestyle things, they are additive to a point of what I call exponential effects. Right. So maybe just doing one thing, it's like, maybe it'll help. But then when you do some of these things integrated synergistically, it just like compounds, and then it's like just flows so much better, right? So 1 + 1 is 4 in an exponential effect.
What I find most exciting is when a patient is doing everything lifestyle wise. Perhaps they have poor genetics and they have endometriosis or PCOS, and then they add the herbs and the acupuncture, and there's a huge noticeable difference. So they already have the baseline of healthy lifestyle. Right. And then it's synergistically added the TCM herbs, and it's so drastic and noticeable. Yes. It's exciting for me.
It is exciting. Yeah. And that's why in China, it's all integrated. Here, there's more hesitation. And I get it, because doctors are really freaking busy anyway. So they don't have time to look up herbs and herbal interactions. So it's easier for some of these doctors to just say hands down, no.
Yes.
And really what we like, if you're going to work with a physician, maybe if you want to do Chinese herbs, it may be better to find a physician that is a bit more aligned and open to it. And at the very least, you need to actually say, I am doing something. But unfortunately, there's a lot of fear, and there's still to this day, I find, I don't know about your patients, but do you find that your patients may not even tell their physicians what they're doing on the side?
I'm finding more and more that they are now sharing.
Okay, that's good.
And there are still the disgruntled practitioners who say stop, but I would say it's becoming, because I've been in this practice for since 2005, but I was raised seeing naturopathic doctors. So the change is humongous. So people are more open. There are a lot of doctors out there that have had personal experiences, and we treat physicians,
that's right,
as patients. So people are becoming more open, recognizing that lifestyle plays a huge role, and that traditional Chinese medicine is not just some hokey medicine, actually has science behind it, and it's evidence-based. So yeah, 100%. There are going to be more and more, I see more and more practitioners who are open, but there are still those that are a bit stuck, I guess you could call it, and they're just a little bit closed-minded, perhaps because they've been, focused on their medicine for years. But
sure.
There's a shift, I would say. I would say a 50% change shift.
50, yeah, I don't know what the percentage is, but you're 100% right, because so it's been 29 years for me. And when I first was into practice, they're like, acu what? Or like for acupuncture, but now everybody knows that word, right?
Yes.
And so there is a huge shift, and some physicians are more open for sure. Mm-hmm. A testament to it is that we do podcasting, and we actually oftentimes will interview physicians, and they're so open. Yeah. It's great.
And treat. Yeah.
Yeah. So you go back and you check out all of our episodes, because we do really contemplate and look at both sides of the coin and how we integrate it. Right. So we talk about even like health of embryos, what with Dr. Laura Marshall and with Dr. Sharma, we've talked about genetic testing, all those kinds of things. So check that out. Anything else to add, or do you have any other questions about herbs, or are we feeling complete around this subject?
The biggest question that got answered, which was when to stop, taking them. And I think because as long as you're seeing a practitioner who understands that, they're going to be customized and, changing, and like, as long as they're a registered practitioner, I think it's important. That's
well-versed in this. And then I'm going to add a very practical note of advice. Mm-hmm. So here's the thing. Some people will want to keep taking herbs during their pregnancy and, with good reason, with any kind of prehistory, like repetitive pregnancy loss or anything like that, or like autoimmune issues. But practically speaking, we've talked about this in the past, like when you're pregnant and if you're nauseous, like you don't want anything. It's like, whoa, right? Like, we were talking about, it could be a little fragrant, a little pungent. So depending on the person, you may or may not be able to tolerate it. So there's a practical component as well, but it should not interfere in any way. If anything, it can augment wherever you are in your phase of conception, whether trying to conceive, during pregnancy, postpartum, because it's well documented for thousands of years that there are lots of herbals that can help. And don't forget, or maybe you won't know anyhow, but the pharmacopoeia of herbal medicine, there's like at least 3,000 herbs and counting, right? So there's a lot of things that we can utilize that is completely safe, as long as you're with a certified, qualified herbalist. So I hope that was helpful. And if you guys have questions, please reach out to us. And if you have ideas of, what you want to ask and you want us to cover for our podcast, let us know, because we want to help educate you so you can make informed choice.
I was just going to say Western herbs are different than traditional Chinese medicine herbs. And a number of herbs we say that are safe in pregnancy are so limited because there are all these theoretical properties. For example, peppermint and chamomile have abortifacient properties. You'd have to drink a whack load of it, a ton of it though, for to actually have those properties. But we always err on the side of safety, and it's literally narrowed down to oat straw, lemon balm that are safe, and ginger, and then later on in pregnancy to help with uterine, the contractions and labor and birthing. Red raspberry leaf tea has been studied. So it's very limited on what we recommend. So traditional Chinese medicine herbs are completely different. So as long as you're with a practitioner that knows the safety profile, you're good. But from a Western medicine perspective or Western herbal medicine, it's such a limited amount of herbs, and also how you're taking it too. You don't want to take it if it's an alcohol base.
Totally, for sure. And, this is where the one thing when Dr. Burns was on that I wanted to add in is Dr. Google is kind of your friend, but don't use it as your guide. When it comes to supplements or Chinese herbal medicine, don't just read it up and go, okay, I'm going to take this because I think this is me, right? You really do want to see someone qualified that really knows what they're doing, because you don't want to mess around with that.
Yes.
Great. So that's all I have to say.
Perfect.
And, we'll do another episode. We'll bring in Kim Heng, our herbalist at Alive. And so we'll do a deeper dive and maybe actually suggest a couple of things for real. Okay. Thanks, guys, for watching. And we shall see you soon. Please subscribe, share, comment, and again, reach out if you have any topics that you want us to cover.